Throttling or manual strangulation, asphyxia is produced by compression of the neck by a human hand. Human hands is known as throttling. Death occurs due to occlusion of the carotid artery or vagal inhibition, which is much more common than in a ligature strangulation. Hanging accepted. Occlusion of airway plays an important role. Postmortem appearance. Externals, bruises on the neck. Situation and extent of the bruises on the neck will depend upon the relative position of the assailant and victim. Manner of grasping neck, the degree of pressure exerted on the throat. The bruises are produced by the tip or part of the fingers. Their shape may be oval or round or the size of a digit, 1.5 to 2 centimeter. But continued bleeding into the conducive area usually increase in size. If the fingers spread across the skin surfaces, the long irregular marks may occur along the jaw margins and chin. Usually more force is used than is necessary to kill the victim. A grip from the right hand from the thumb produces a thumb impression on the right side of the victim's neck, which is usually under the lower jaw or the corner of the thyroid. Several finger marks are seen on the left side of the neck obliquely downward and outward below the others, but sometimes are grouped together and cannot be distinguished separately. In a grip from behind the victim, pressure is applied all around the neck, but some areas of bruising more prominent due to pressure on the fingertips. When both hands are used to compress the thumb of mark of one hand, the finger marks of other hand usually found on either side of the throat. Sometimes both thumb marks are found on one side, several finger marks on the opposite side. A grip from both hands, one being applied on the front, other to the back, produces bruises and a front on the back of the neck. In case of children or where victim's neck is small or assailant hand relatively large, bruise may towards the back. Due to shifting of the hip grip, sometimes the frank struggling of the victim anywhere and even on the posterolateral side of the neck on the upper chest and collar bones. Finger movements causes a bruise and other things. Bruises may be over the prominence of the larynx and at the level of the cricoid. They may also see the grooves on either side of the larynx. They may also over the prominence of larynx at the level of the cricoid. As such, it cannot be definitely determined which hand was applied from which side. In such cases, it is not possible to tell whether an assailant seized the victim from front or behind. Sometimes the movement of the fingers may cause larger irregular bruise. When a fresh, the bruise may soft, red and more. After several hours, they appear more brown, dry brown parchment like. The soft material is kept between the hand and throat. Bruising may not see. The pressure upon neck is maintained until after the death of the victim. Bruising may be absent because there has been no blood flowing to the extravas from the damaged vessel. Rarely in throttling there are no external injuries or internal injuries. This occurs if the victim is unconscious or amount of pressure to the neck is minimal. Next is the fingernail abrasions. The fingertips are pressed deeply. The pressure of the nails produces crescenting marks on the skin. They are more likely to be seen at the site of the thumb than the fingers. Because when the throat is gripped, the thumb exerts more localized pressure is less likely to move than the fingers during struggle of the victim. The fingernail abrasions are of two types. When the pressure is static, regularly curved comma like dash like straight up to 1.5 centimeter length and a few millimeters width. When the skin fails down the skin parallel linear lines several centimeters the length may be seen. Many scratches may be several millimeters wide and place a centimeter or so apart. They produced by the victim herself while trying to pull away the assailant's hands. As most victims are females, the nails may be longer, scratches more severe than those by the assailant. This different scratches may be seen in parallel lines. in vertical direction in the long axis of the neck but are often random. The fingernail abrasions are much less common than bruises. Victims' fingernail scraping may contain fragments of skin, blood, hair, fibers. Irregularities of the nails of the assailant may leave a signature on the victim's skin. The alleged assailant should be examined to correlate any injuries that may have inflicted on him by fingernails or victim. And his fingernails scrapings should be taken. If only one hand is used, there is more extensive abrasion on the side of the neck to which the fingers were applied. Thumb marking may show few scratches. If numerous scratches are found on the left side of the neck and the victim's neck, inference will be that throttling was by the right hand of the assailant and vice versa. Okay. Hemorrhages in the subcutaneous tissues. Hemorrhages in the subcutaneous tissues and the muscles underlying nail mark is usually scanty when compared with external injuries. In some cases, linear impression is produced. It is commonly assumed that the concavities of the crescentic abrasion follow the anatomical shape of the nail margin, but may result in completely contrary. According to the Gordon and Shapiro, the shape of the fingernail largely determines the result. Nails with a straight border pointed towards the center of the free border and paradoxical results are common. A fixation of the skin at the center occurs where the nails digs in with the escape at the margin, so that when the traction releases, the mark appears inverted, the convexity facing the finger part. In some cases, injuries are indefinite. Abrasion which may not be noticed unless examined carefully. A wet body may not show fingernail marks until drying of the skin has occurred. Signs of asphyxia: face is usually congested, cyanosed, petechial hemorrhages, tongue protruded. Signs congestive asphyxia sign happen 15 to 30 seconds of pressure on the neck, but if a change in the grip occurs in the finger impingement carotid structure, reflex cardiac arrest occurs, so that intensity of congestive changes may be of any degree in any given death. Next is signs of a struggle. Bruises and abrasions. Bruises and abrasion may be found in any other part of the body. In this case, in cases where the victim has forced in the ground, has been held down, the bruising may be found in the scalp tissues over the back of the head, in the tissue overlaying the spinous process of the lower cervical vertebrae, the upper dorsal vertebrae, in the tissue overlaying the posterior surface of the scapula, or the muscles front of the chest and abdominal wall. If the assailant kneels on the victim, if the force is considerable, a fracture of ribs, conditional lacerate, the abdominal organs may be found. Fingernail markings and fingertips bruising of the face are quite common. There may be an attempt to obstruct the mouth, producing injuries of the lips. Thank you.